Root canal therapy is a procedure used to retain a tooth, which may otherwise require removal. Even though there are minimal risks with all dental procedures, root canal therapy has a very high degree of clinical success, generally 80 to 95%. All patients who undergo root canal therapy need to understand the process and the risks involved before giving consent to treatment. This educational video by Surgery Squad will help patients, guardian, and family of patients understand the steps involved in the process of root canal treatment, as well as the risks, benefits, and complications before they complete a consent form for therapy.
Welcome to Surgery Squad's virtual root canal procedure. I'm the one and only Dr. Jeff, and I'll be helping you with this surgery today. A root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth. During a root canal, your dentist or endodontist will remove the pulp tissue within the tooth. Once everything is removed, they'll clean out any contaminants inside the tooth and seal it to prevent any further infection. Our patient today is having a root canal performed on their lower right second premolar. In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. This will help reduce any discomfort the needle may cause. Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums, just below the tooth we'll be performing a root canal treatment on. Let's give our patient a few minutes to relax and for their mouth to become completely numb. Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth. Once the rubber dam is in place, put on a tooth clamp to keep it from moving. Next, we'll need to dry out the tooth as much as possible using our air-water syringe. So far, so good. Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill. The next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot. At this point, the dentist would measure the depth of the canal using a combination of X-rays and specialized equipment. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection. Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach. We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved. Great! Now use the suction to remove the bleach from the patient's tooth. Next, we'll need to fill the tooth using a rubber compound known as gutta percha. Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the gutta percha cone. Let's see what you can do. Looking good. A heated instrument is now used to remove the excess gutta percha. Pack the gutta percha into the tooth canal using a plugger. After the gutta percha has been placed, it is common that additional x-rays are taken to verify that the canal has been adequately sealed off. Once the dentist verifies that the canal has been sealed, a filling or crown is placed, depending on the location of the tooth.
The video provided you with the knowledge on root canal therapy, the steps involved, as well as the risks and benefits. The informed consent form and brochure contains important information on post-operative complications, follow-up, and contact details. If you agree to continue with the procedure, please read the consent form and sign it. If you have any questions, feel free to ask the professional in attendance. Have a good day.